Welcome back. In this video, we'll talk about autism. The following symptoms and features that we'll talk about has to start from young age and persist, which means that if a patient suddenly develops the symptoms of autism at an older age, or if they had these symptoms when they were younger and then they stopped having them and started having them again, this would not qualify for the diagnosis of autism. Autism disease has two must-have or mandatory abnormalities and two optional or common abnormalities. To make the diagnosis, all autism patients has to have strict interest and strict routine. So they would have significant interest in one aspect, and often they would be very good and excel in it, like drawing, for example. And they would have strict routine and resist any deviation from it. So autistic patients has to have these symptoms to make the diagnosis. The optional symptoms are speech abnormalities and intelligence abnormalities. They don't all have these symptoms, but it's pretty common. And the key feature for speech abnormality is that they don't try to compensate through non-verbal means. So autistic patients do understand what you're saying and they do know the response, they're just not saying it. Unlike if the patient, for example, had a cleft lip or a cleft palate, this would also cause them to have speech abnormalities, but these patients would try to compensate by using hand gestures or saying the word multiple times, trying to get it right. The hallmark or key feature of autism is the absence of joint attention, which means that these patients will not show interest in what interests others. If you sit in front of a child who does not have autism, and if the child was drawing something, then if you suddenly look amazed, turn your head and start looking at something else, the natural reaction for the child would be to be intrigued and interested, and they would look at the thing that you were looking at, trying to figure out what made you interested. This is called joint attention. Autistic patients will not have this finding. So if they're interested in something or doing something and you suddenly look amazed at something else, they will not join your attention by looking at that thing as well. Instead, they will stay fixated doing whatever they were doing. The management of autism is non-medical and more focused on therapy, mainly behavioral therapy and educational intervention, and if needed, speech therapy and occupational therapy. Alright guys, that's all I have. Hopefully this helps, and thank you so much for watching.